I'd like to turn our attention now to the intersection of Melnia Cass Boulevard and Massachusetts Avenue, where today the city began removing tents and temporary shelters from the area after Acting Mayor Janey declared a public health emergency there. Meanwhile, Suffolk County Sheriff Steve Tompkins is readying a facility at the South Bay Correctional Center for treatment using involuntary commitment. Beginning with you, Councilor Saiby George, do you support what the Suffolk County Sheriff is doing, and would you work with that approach if elected?
So certainly want to explore innovation. When we think about the crisis at Mass and Cass, when we think about the crisis of homelessness and substance use disorder and mental illness, we have to think innovatively about this crisis. But locking up people who are not well, who are sick, is not the answer to this crisis. And I will say, taking down of tents did not start today. I spend quite a bit of time at Mass and Cass. It's been a big part of my work over these last 6 years. I was there this morning and I was there late this afternoon. There are more tents than ever. There is more violence than ever. We've had 6th and I think a 7th this morning murder at Mass and Cass. We have women who are regularly victimized and raped and human trafficked at Mass and Cass, and that crisis is touching so many neighborhoods across our city. I will move on that public health emergency. I'm grateful that the acting mayor took that after I made an updated Mass and Cass plan. We have to create a specialized zone in that community to make sure that we are able to coordinate resources to better help individuals who are not well.
So just to be really clear, you do not support Sheriff Tompkins' plan?
I don't support the plan specifically as it's written. I applaud the innovation and the creativity. We've got to think outside the box and how to assist people who are not well. We have hundreds of individuals today in tents. Not one tent has been moved. We have to protect the personal belongings of individuals who are struggling. We've got to decentralize services. We have to work with other communities for help. I am committed to not building a wall around the city of Boston, but working with other cities and towns to do more and rebuild the Long Island Bridge.
Councilor Wu, same question to you.
This is an urgent humanitarian crisis, past emergency level, and I'll make sure that we see the leadership, accountability, and coordination across all levels of government that are badly needed here. One of my very first hires is going to be a cabinet-level chief focused on the Mass and Cass area and our larger opiate crisis, homelessness, and mental health, reporting directly to me for full accountability. I'll make sure that we are connecting people to treatment and also retrofitting and looking at city-owned property, public property for supportive housing to get people out of the streets into shelter. When it comes to this specific plan that's been put forward, there are multiple components of it. The creation of a stabilization court to divert cases away from the criminal justice system is an important step and one that has come with so much work, and my deep gratitude to Mayor Janey, our district attorney, attorney general, and so many others. When it comes to the piece about where we house folks who are needing treatment, we cannot have a criminalization lens. We must have a public health focused lens. And so what I take from this conversation is that there are facilities, empty buildings that are available. Let's make sure that we are not leading with law enforcement, administering programs, but we have a public health lens and use every resource on the table.
And again, so am I understanding that you are not in support of what Sheriff Tompkins is preparing to do?
I support the actions to ensure that we are taking steps right away before it gets cold. Every single day that goes by, we're closer to winter and freezing temperatures, but let's make sure that this is a conversation where we have a public health focus and leadership rather than law enforcement leading the charge.
So staying with you, Councilor Wu, let's take a longer term view now, and I'm actually going to ask you to speak to the people of Quincy instead of the people of Boston and address the people of Quincy directly about what you are asking them to do in terms of restoring a bridge to Long Island.
I do not support focusing our energy on building back a bridge. This has been a conversation that the city of Boston has had for 6-7 years now, and it is a major construction project in the order of $250 million plus that would require construction in the open ocean at the time scale of 4, 5, 10 years into the future. I welcome and will lead the way to ensure that all of our regional partners can be working together, because this is a crisis that truly affects all of us. But I want to make sure we're taking action in the 4-year mayoral term that I am seeking, not for a bridge project that is out of that frame. Let's use that funding, put it quickly to supportive housing and other structures, and activate Long Island through ferry service so that we can make sure we're also building a recovery campus back on the island.
And
so, I'm sorry, so you do not support the idea of even starting the process of building a bridge at this point? so that it would be usable like maybe 5 or 10 years down the road?
I do not support putting our resources to focusing on the bridge. I'd move quickly to reactivating ferry service. We are in a legal process that is near completion, so we can finish that process, but our resources can be used much more urgently with much more impact for folks at Mass and Cass and across our city, for residents in the area, for small businesses, if we are looking to reactivate ferry service while we're moving quickly to retrofit supportive housing on city property.
Councillor Seiby-George, do you have a message for the people of Quincy?
So I've got a message first from Michelle. Because she's been stuck in conversation, she doesn't truly understand the crisis that is Mass and Cass. I've spent days, nights, and overnights at Mass and Cass, and our city's residents who are unsheltered are in crisis. They need help today, not the start of a conversation. This work under my administration will start day one. I am prepared not to just name that chief on day one, but to extend the public health emergency, to create this new zone for better coordination of city services. And I'm not going to walk away from the battle with Quincy. We need to do this work as a city in an effort to help so many people who could be my children, your children, are someone's loved ones that need help. It will be a bridge built under my administration. It will be an island for recovery service built and renovated and fixed and repaired under my administration. It will also be an island that has access to ferry services. I will not give up the fight with Quincy to do this work. It is our people of this Commonwealth, of this region, who are suffering every day. We've got a lot of work to do, and I'm committed as mayor to do it.
Can that be done in a single, I'm sorry.
No, go.
Can that be done
Yes,
in a
it
single
can be.
mayoral
We've got
term?
incredible resources. We've got incredible minds. We can do a bridge hackathon and get this done. As Michelle mentions, we're near end of the legal litigation that's been brought on by Quincy to delay getting help to people who are suffering every single day. Makes me wildly crazy that we have not helped individuals who are in crisis, that we have not responded to the needs of a community, of business owners, of those going to work, of those frontline workers reaching out every single day to help individuals in crisis. We've got to move quickly on this, Michelle. We have to move quickly.
She's engaged you, Council. What is your response?
Look, I'm grateful for the councilor's passion on this and for the many, many meetings and conversations that she's been part of. We've both walked the streets in that area, both have been on many visits with the business owners, with residents, with healthcare providers there. Every conversation that I have is about taking urgent action. The bridge and the price tag of doing so means that we would be giving up and diverting our resources away from urgent action. I'm not willing to wait, and I'll ensure that we are moving quickly to provide the housing and health care and treatment that these residents need.
I'd like to continue because this crisis is so important. When I think about the doors I've knocked, the conversations I've had with our city's residents, they have very little interest in freeing the T. They have very little understanding of rent control, but they know the crisis that's Mass and Cass because every resident of the city has been touched by that crisis. I have done more than talk. I have done more than have conversations. We've worked to increase best clinicians who are working tirelessly every single day trying to access resources for individuals in crisis. I have worked with the outreach team on increasing their efforts for mobile sharps. I have worked with the Mass and Cass Task Force and the South End Task Force to do more for people who are suffering every day. Not conversations, hard work. It is hard work to lead this city, especially for our most vulnerable. We need to be committed to it, and I am.
Councillor Wolf, you have something to say?
Look, the situation at Mass and Cass has worsened over the last 6 and 7 years, and especially during this pandemic. We cannot wait to take immediate action. But we also must recognize that when people are finding themselves pushed over the edge, it is not just because of one incident that has happened. It is systems that have failed, systems that include the lack of affordable housing, systems that include transportation access that is too expensive and not reliable, systems that include our education and jobs that are available. I'm taking an approach that would address all of the issues that we need, and I'm not willing to say that this is not possible for Boston to get done. I won't underestimate our city and what we're capable of. I will fight for what our residents need and deserve.
These conversations are taking much too long for the men and women who are on the street tonight, for the women who will be raped tonight, for the individual who might be murdered tomorrow. We cannot wait for conversations. We've got to act. We've got to do the work. We've got to invest our city's resources, our manpower, our intellect to fix this problem once and for all. And the individual struggling today cannot wait for conversations around public transit, cannot wait for conversations around education. They need help today, tonight. They need help.
Look,
We're going to have to move
all
on.
I'll say, I need to just add
give her
one
a chance
point,
to
which is
respond.
that I'm not exactly sure which conversations my colleague is referring to, but every time that I go into a conversation or a meeting, I leave with action steps. That is why, in terms of the legislation passed, the number of fights that we've taken on and successfully won, there's no comparison between what we have each gotten done in terms of the delivery and results. I have been leading the charge in partnership with community to deliver Boston's first free bus route that Mayor Janey has been an incredible partner and leader on. I have led the way in making sure that cities across the Commonwealth are talking about transportation access that is necessary for all of our residents. We are in a moment of crisis. We cannot just continue to point fingers and say what is not possible. I know that when Boston takes on the big fights, we get things done, because I've done it time and again on transportation, on driving down rents by closing loopholes for Airbnb and big companies, on delivering paid parental leave for city workers, on ensuring equity in city contracts, on changes in our climate and renewable energy. I am proud of the work that I've been able to get done on the City Council, because it's important to hear from residents, to talk, to be in community, and then to follow up, not point fingers, but get things done.
Adrian?